Okay, thanks for joining, Ms. Kathy. So this is a wonderful day that we are going to start our series. I'm happy to hear that she is my colleague. That means she was my college mate, where we met and we were traveled for 4 years. And now she is my guest. I am just sitting just before to her to know about many things about the mental health. And as today's topic is related to the nurses, that's specifically for the mental health. Why? Because she is specialized with the mental health nursing. And I want to give an intro about herself from my end, but I don't want to give it from my purpose. Why? Because she is a well-known person when she was studying along with me in the college. She participated in many elocutions and many competitions. Like her speech is like wonderful. I want to hear the same here too. And thanks for joining here, Kathy. And tell me about yourself to my audience.
First, thank you for welcoming joining this podcast series with me. So, it is all about me. I've completed MSc nursing in mental health specialty, and I'm currently working as assistant professor in College of Nursing. Um, so I chose nursing since it's a professional course. That is how I came into nursing, and gradually, passion for teaching made me a teacher. So when I was in a 12th grade, I was a biology student, so I wanted to something for people. I wanted to learn medicine. I think I cracked entrance exam for medicine in only government colleges. The next thing I wanted to serve for people was instead of going for any degree, I thought for the professional course and then I chose nursing. And that's how I started my journey in medicine. Slowly, I developed
Okay.
a passion for teaching. That was fun one, but still, I suppressed this. But again, I went to side of teaching.
Okay, that's great about Kathy Roy because this is all of many nurses who wants to become a doctor, who wants to do MBBS, but because of some problem or issues, we came into nursing. But we will not leave the service which we are going to do it for the patient. It might be a doctor or a nurse or any kind of paramedics too. Thanks for your introduction. And why specifically it is mental health in your PG? That's I am eager to know about. There are many specialties out there, but it is I don't know why people chooses medical surgical for long term. Why? Because many of the people does that one. But you specifically chose mental health nursing. That is literally different when compared to other people. Why it is?
Actually, my first nursing was I can't say that my first priority, but that was because initially I worked as a staff nurse in a bone marrow transplant unit. So I wanted to become a transplant nurse, and that was specialty hematological nursing in MSc. But when I saw uh, during the period when I had to join the MSc, I didn't have colleges for that. And same thing was MSc and mental health nursing. So I opted this. Why? Because health, the definition of health says physical and mental health. Many people concentrate only
Yes.
on health, and mental health is almost neglected. Not only for nurses, neglected by even the commoners. So, not all psychiatric disorders, we cannot tell that they are psychiatric patients. Like stress cannot be defined or the person cannot be marked as psychiatric. So, uh, and one specific thing I always used to tell because I was asked to take medical surgical nursing by my mother, but I told her whatever disease you have, finally you just test. You think about it. Your emotions, thoughts,
Yes.
and behavior will affect the physical condition. So every underlying disease or physical illness, anything will have a background of mental illness or emotional strain. So mental health will be useful. I thought that was a need for that. But once I told
Yeah.
my started as mental health nursing, only during the COVID time, many started speaking about mental health. Since they were isolated, included during COVID lockdown.
I had a same situation when I got COVID and I was kept under four boxes. That's a room of a patient, and literally that 7 to 10 days I struggled a lot. That time I knew that health is not only the physical matter; it is about the mental also, the emotional status. Nobody was there along with me when I was admitted in a hospital. That's well and right statement that you gave, that it is not only the physical, it is also mental well-being. Okay. Who inspired you to choose this mental health nursing actually to work in this field?
I can't say specific inspiration. That is, I told you, I want to see people, not through physical treatment, but through technique, because I am a very good orator and I'm an extrovert. I like to speak to people. I like to socialize to people. So,
I want to tell one more thing. I know that you are a very good speaker and you are a well-versed speaker because I seen you in my college days. Yeah, yes, please continue.
so the can aspect where it is given what I can't keep my mouth shut. I speak to it. So I thought this would be good choice for me. And yeah, my mental health story is affected me.
Yeah,
She
okay.
has a role in
It's
that.
great. Yeah, it's great. It's great. Okay, we will step onto our today's topic. Actually, like, today's topic is just dealing that what are the mental health. It is going to affect the nurses who is working in hospital. And as usual, when some student is learning nursing in their college or anybody else in a college, why do they also have any problem in emotional or in the mental well-being? What kind of thing we are going to do it on this particular one? So I just want to step on to some questions that I need to ask to you. The first, it is why the mental health among nurses often neglected.
Okay, when it comes to often neglected, I think that it is often neglected because nowadays people have started caring on their mental health. But even uh, going to a few couple of years back, it was neglected. Not often, always. And now it
Yeah.
is often sometimes where it depends upon the institutions where people work. Some institutions really concentrate on their physical health and mental health of employers, not only nurses, everyone. But some
Yes.
they just only concentrate on continuing education, improving their knowledge furthermore, but they don't care about the mental. So
Yeah.
that might be one of the reasons why it is often neglected. But the second thing is, you always think if I am emotionally drained or if I have emotional distress or stress, work life stress, having work life stress is like the things that are incompetent. Sometimes, what if I
Yeah.
say I'm not able to do that work? It's over. It's stressing. It's stress for me, or I don't have the time. I'm having time constraint to do that work. Then I think, what if I tell like that? I might be seen as the person who is incompetent to do that. Or I might be
Mhm.
labeled so she's not able to do that. So she's saying those excuses, same
Okay.
excuse. They are not verbalizing what type of stress they are eventually feeling during their work or workstations or workplace. And next important thing, stigma. Stigma regarding mental health. Even after studying nursing, psychiatric nursing, people think having stress even is psychiatric disorder. Like I have to get
Yes.
depression, anxiety. I have to get treated by a psychiatrist. Not all mental illnesses needs to be treated by a psychiatrist or with psychiatric medications. Few can be just reconstructed only with counseling, venting out or some type of exercise or soft sessions. Those things can even help us or can get together. So people have a stigma regarding all mental illness or psychiatric employees to the psychiatrist. That is one of the things why the mental health is commonly neglected. And the next thing will be emotional pain where everybody they see trauma, they see pain, they see patient suffering. So emotional numbness will start. Okay. Initially, they will be a comfort. They will have comfort for the patient. Like இது சரியா போகுது. This will become okay. But eventually, when you reach
Mhm.
1 years old, sometimes they even feel this is normal. Patient, everyone is in pain, so they emotionally get numb. That is why their mental health is neglected. As for others,
Okay.
and they are that they don't have their mental health. Sorry for the disease. Their mental health. They make themselves forget them.
Okay. Okay, well said, Kathy. So this is that we need to focus on so much of thing for the nurses who is working in the hospital. And my second question is: are nursing students also affected similarly like this, or it is something different?
Yes. When thinking about this, the truth, the thing, the essence starts from the student life because as a nurse is different and studying is different. Even during their student life, they get to clinicals, they get trained, they see patients, they get emotional trauma, and
Yeah.
also some they experience. Uh, as a student nurse, it's first experience as a as a profession for the first time. Next few weeks they will be emotionally disturbed. They might not be come set up again. That is
Hmm.
the major reason why students get well. Reason would be, as you all know, academic overload, cat plan,
Yeah.
cash
Yes.
study, right?
Yes.
Nursing,
We already experienced many things.
nursing has a lot of written work, so we have to experience and the night shifts. Usually, when we work as a nurse, a night shift is followed by a evening shift. So at least they get a pattern to sleep. They get some time to sleep. But here, as a student nurse, Sunday morning they go from their night duty, and Monday morning they have to return back to college. So that is one of
Yes.
the lacking. So after night shift, they get emotionally drained or physically exhausted, which makes them have a hatred towards night duty. Eventually, even at the early days of their nursing journey, those
Yes.
things sometimes comparison with fear from what if I'm not able to perform well as them, exam fears, not
Yes.
completing their requirements, having arrears. So everything puts
Yeah.
the nursing students in fear because
I think I want to add one more thing, the logbook. The
some
very big stress to complete the logbook. It's matters that you need to complete the procedure
maximum
four
three
times to get a signature.
is
Yeah,
of
yes,
course
of course, I'm saying the same.
Viva. So it
It's like
eventually
something I'm just going back to the college days that I'm thinking about the logbooks.
nurses and nursing students are equally stressed. I can't say like that, but they have their own stressing factors.
Yes, yes.
Yeah.
Okay. So that's wonderful that nurses is having stress. And as usual, the students is also having a stress. But I don't know how we are going to remove that stress and make the education as a very good plaything. Then only I think so that this stress will be basically will go to the patient from nurses while in the care. If I'm just going to do some care, I will be thinking like, okay, I have logbook, I have a case study. When I was a student nurse, they gave me internship opportunity that like you also experienced the same. when we go inside the ward or ICU, we will not think about the service or the care to the patient. It is all about how I will complete the case study, how I will complete my care plan. Tomorrow morning, whether I can go and complete my viva or not, whether I will get a sleep time or not, it's like a hectic thing. As you said, many things are there, but even though I don't know how we can change that thing, maybe this series will help many students or nurses to get rid of this kind of stress or the depression in future. I think so. I have that hope.
Adding a point, for nurses and students, there is at least for students there is a time period to have relaxation. They have culturals, they have sports, and they have n number of activities. But coming to the nursing, working nurses, I don't think so. They are given equal thing or enough entertainment during their work life, because work is totally work. Student period is totally student life.
When we are as a student, we enter into a ward like a student. But as a nurse, you have a entire roles and responsibility to manage the patient. Not only the patient, it is like you need to manage their relatives, the doctors, chief doctors.
Actions while we
Yes,
are working as a nurse. We become
yes,
accountable.
yes.
Everything happening
Yeah, of
inside the world.
course. Yeah, yes, yes. Well said, Kathy. And how do this night duties and workload affect the mental health of a nurse?
Coming to night duty, as you know, circadian rhythm is the main thing uh, which helps us rejuvenate our body. The sleep cycle is disturbed. So initially, thinking about this, I used to ask my students how long you need a night shift, because there are a routine. As a student, I had 6 days of night shift at a stretch, and my students have 7 days of night duty at a stretch, starting from Sunday night till Saturday night, and they get only one off. So they said maximum we can see 3 nights. So the
Yeah.
fourth night we automatically get exhausted, we get tired. So that tiredness reduces the care quality of care to the patient. Automatically, the nurse gets frustrated. She's not able to give a full care. She feels herself not competent to work in this field. That's why some people opt out of night shifts only during this kind of encounters. They say like, I'm not fit for night shift, or I'm not eligible, or I'm not worthy to do a night shift at a shift. So I think night shift should be constricted to particular days. The council or the government should bring about night shifts, like at least for 3 or 4 consecutive days they can have night shift. Then we should give them a break, because certain hospitals they give night at a stretch 6. So 6 nights, the nurse actually gets exhausted on the third night or the fourth night, and the rest of the 2 nights, that is where they get their stress and emotional numbness. Their quality of care decreases, and that's why they become drained. Both energetically, they are drained with nothing. And even during night shifts, the staff's ratios are very less. Sometimes the same ward which has a staff during morning shift and a 4 during evening shift, when it comes to night shift, the staff have been reduced. 2 for a ward is enough. Or because night is a very long period, you're not going to do a lot of work. But we can't say. It depends upon the ward. It depends upon how many people, how many patients we receive from emergency. We can't predict the night will be busy or the night will be free of things. So staff shortage makes them have a lot of workload, and everything they have to attach sheets for the next day. They have every preparation for the next day. Everything is done. So as like day shift, night shift also should have the same number of staff nurses with the patient, a good amount of nurse patient ratio. So reduction of staffs during night shifts makes them automatically have a workload overload, and they have that hatred towards night shift. Ayo night shift, Annamari.
Yes. Yes, yes. Of course, I agree to that. But many people says like they compare IT along with the healthcare. Most probably, if you see IT, they work to the night for a whole month. Some people will work for the entire IT period as a night shift only. But when we say like 3 days and 4 days, it is very hectic. They are seeing us like something different, something like an alien. Why you can't work as a nurse or a doctor in a ward or in an ICU for a long period of night shift? We are working for the entire month, but why you can't? They are asking us. What the kind of the thought it reminds like nurses and IT or some other professions who do a night shift for the prolonged time, for the long month. What it is differs.
Coming to this, I would like to tell two things. One is uh, doctors have 24 hours duty, 72 hours duty, 48 hours duty. They work at a stretch. At one point, they
Yeah.
need some. Okay. So coming to this IT sector, their routine is even the same. Like I know people
Mhm.
who 5 days, Monday to Friday night, they work. Saturday and Sunday, they get off.
Yeah.
Okay. So their routine is even at daytime, they get a whole sleep and they work and they're not carrying human beings. We
Yeah.
are
Yes.
accountable for life. In case of
Mm.
IT people, they are working with machines. Working with
Yes.
machines cannot be compared to a human life. Errors,
Yes.
okay. Their error is also something big. It might cost something to the company, but working with life cannot be compared to working with machines.
Yes.
So,
Of
and
course.
automatically having a night shift for whole a week or a whole month or working only night shift will make them like adapted to that. But here we are having A shift, sometimes B shift, working in night shift, again coming to B shift. The change of shifts makes them change their life pattern, and they can't have a good routine for themselves where they can care for them. That's what.
Yes. Of course. Why I do compared with IT in the sense?
Yeah,
Yeah.
only thing
Yes,
I
Kathy, you're saying
we
something.
are working with machines and we are working with lives. It cannot be retrieved. This at least can be compensated. Life cannot be compensated.
It is not comparable itself, actually. Why
Yes.
I just compared this thing along with IT in the sense, our nurses who is working in a medical coding, they are working as a night shift and they are saying to a nurse working in the hospital that we nurses working in medical coding, we are doing a month, full entire month as a night shift, and you people for the 3 days, 4 days, or 5 days itself, you are like this. I hear this statement recently. That's why I want to put up this question here. I do know how difficult the night shift will be. Entirely, I also struggled a lot.
Speaking about medical coding, here the nurse is answerable to the patient, to the doctor, to her superiors, to the patient's relatives. But there, the person is only accountable to his team leader or the manager. So we have a
Yes.
lot of things to do in
Well
night
said.
shifts.
Well said. Kathy. It's well
And
said.
every time we
And
enter patients,
yeah.
new routine, new medication, and every patient will have their own different problems. But in case of working in IT field, it is a routine work. What they do daily, the same thing they do. They don't encounter different patients or they don't encounter different scenarios every day. So they are used to
Yes.
doing that job.
Yeah, yes, yes, right. You're right. So, what mistake do nurses commonly make while handling the stress?
Okay, while handling stress, a nurse commonly thinks like they don't vent out, they don't seek help because if I seek help, as I said initially, they might be labeled incompetent or they might be able lazy. So they are neglecting to seek help. That's why they are not able to have a good work-life balance. And
Yeah,
a ward as a junior nurse, they should get familiar with the thing. So instead of making them familiar, making them first, they nowadays they have given like buddy nurses. They are telling they are accompanied with senior nurses first initial days of training, and then they are given their own patient. but sometimes they are directly given their own patient. All of a sudden, the first week, even they are given night shifts where they cannot manage the stress, because as a student, they would have experienced something different. So, working as a nurse, for a junior nurse especially, they should be first accompanied by any seniors, and then once they are familiarized, they can go. That is one way
Yeah.
they can let the stress. And another thing is the continuous pain and trauma which they face in the patients. Sometimes some nurses take it very personally. Okay, that's
Mhm.
nothing
Yeah.
wrong. Empathy is fine, but carrying the baggage or having displacement, uh, where some workplace stress if they have, they go show it in their family. Again, there is a family dispute. Then they will think, okay, due to the work, I'm showing hatred towards my family, or I get disputes in my family. So again, they develop a hatred towards the job. Due to this only, I'm having fights with children. So I'm not able
Yes.
to spend time with my children. So they're not having a good work-life balance. That is where they lack the management of stress, I think.
Okay.
And there's
When you say that, yeah.
reduce stress. They are not doing
Okay.
that actually.
Yes. When you say like they are carrying this as a personal and it's like a baggage and it is causing a stress and emotional imbalance. I had experience when I was working in an ICU. I didn't notice that IV cannula is 2 or 3 days old, and I gave a blood component through a IV cannula that got into the baby's hand entirely. It got infiltration. At
Okay.
that time, it was like a very big incident to me that is the first time I did a wrong thing to my patient. And it's literally that time I cried a lot. It's not about the men or a woman. People do a mistake and they started crying. I took that one personally, and that whole month I was under a stress. I don't know how to handle that stress. And one more thing, you will laugh at me. I kept that picture as my screensaver in my phone that I should not do this mistake next time. I don't know how to handle that stress. So when you say that we will take as a personal thing, so that's where my example will be fit to that emotional imbalances, literally. Yeah.
Okay. Saying this, I want to add something. The thing is, like, we take things personally, but making a mistake, that is where we go for a negative coping and positive coping of our stress.
Yeah.
So making
Yeah.
mistakes is not like human makes mistakes. We do errors. Okay.
Yeah.
So we have to not embarrass ourselves, but instead we have to learn from our mistakes. Instead of neglecting it or not working with that type of patient anymore, we can learn from ourselves, so that from our mistakes, so that we don't make it further. Instead of feeling embarrassed, we take it as a learning period. Every mistake is something we learn. We don't do it again. Instead of taking
Yeah.
it as a stress, taking it as a stress is negative coping. Learning from that mistake is a very good positive coping, I can say.
Yes, well said, Kathy. And last question to you for this series. And how important are sleep and social support for nurses? It is important, and I know it is very significant to us. But even though I want to hear something from your experience, and as you are a specialist in mental health nursing.
Coming to sleep, as I earlier said, circadian rhythm is very essential. Sleep deprivation causes a lot of bad moods. Sleep first affects our moods. One, even as a very common people, if you are awakened in the middle of the sleep, you have headaches, or if you are not able to
Mm.
sleep, like irritable mood. So, sleep deprivation affects the mood of the patient. I mean, the nurses very much. So, depending upon that only, their whole day goes. So sleep deprivation automatically it affects their work. So if I am deprived of sleep for continuous 3 nights, and suddenly I am called or working overtime in OT, I'm not able to sleep. I'm on a on-call nurse. I'm not able to sleep. Well, say again morning I'm coming to work. So that time my mood gets affected a lot. Sleep deprivation causes mood irritation, and it also gives anxiety, because What if I fall asleep during any procedure? What if I
Mm.
do miss to my sleep deprivation? Sometimes we do, right? Sleeping inside a class as a student is something different. But as a nurse, if I sleep while giving care to my patient, automatically the thoughts and the behavior of the patient, of the nurse will start wobbling. It will be moving. They will be having a lot of thoughts that will again have an emotional impact on the nurses. So social support is very, very essential because social support here, I prefer to say it as peer support. Peer support and family support is essential. That is the thing. If we have a good colleague, the workplace, even the stressful work environment will be very peaceful. That depends upon
Yes.
our. So peer support is very essential during work shift, especially during night shifts. If we have a half an hour, if one of our peers advises, okay, you take half an hour rest, I will manage the ward. Then we will go for on a rotation. I'll take an half an hour rest. That even is a very good thing. So if that support is not there, again, the night will be very, very pathetic for the nurse. So that is how. At least to
Yes.
refresh themselves, they should have some rest during night. 12 hours at a stretch is, even when it comes to IT people, they don't work for 12 hours at a stretch. That I needed to mention it there because I know persons from 7 to 3 they are working. Just calculated 8, 9, 10, 12. I mean 11, 12, 1, 2, 3. It's only 8 hours. Even if it is night, they work only for 8 hours. They don't work at a stretch for 12 hours.
12 hours. Yeah. Yes, of
So,
course.
sleep and social support is very essential.
Yes, yes, absolutely. When I know that when I was working in a hospital, I came from morning shift and I will be enjoying the evening. But as a night shift, tomorrow morning I will be coming and I will sleep for the entire day, go back to the night shift, come and sleep, go back to the night shift. It was entirely the stressful and nobody knows how to handle the stress. Literally, I want to say that one. When
The
nurses
bad
thinks that.
you had food cooked up in mess or you had hostel food so you can sleep the whole day. Think about nurses who has family. They have to go cook. They have to care for the elders. They have to look after their babies. They have to do homework for their babies. Taking care that puts them into pressure. So 3 days a baby can manage or someone in the house can manage. Especially when because the majority of the nurses are women now, though men are dominating. But from a women point of view, they too have their family, which literally depends upon them for all the household chores. So they
Yes.
get
I absolutely understood that in India, anyway, women are going to the any work like IT job or nurses as a doctor, anybody else. They are not like a men. Men, anytime he can go to the work, nothing, no cares about anything. Only cares about the family, not about the cooking, not about the cleaning the house. But when it comes to the female or the woman, what happens? She need to come back to the home along with the stress carried from the hospital, and she need to clean the home. She need to wash the vessels, and she need to take care of her family along with the husband as well as the daughters or the son. And it's not about stops only that particular point. If it is a very big family, you think that what happens to her. Literally, we need to salute the girls who are all working as a nurses. So why? Because
not only,
they are carrying the stress for the patient.
yes,
Sorry,
not
I
only
couldn't
nurses,
hear.
any night shift should be
Yeah.
appreciated.
Yes, of course, yes. Yeah. So I have a rapid reflective questions to you. Just we will make it as one or two words along with that. The first one is one thing every nurse should hear.
You are also a human, so you have to
Okay.
cap
Okay. Okay. Absolutely. So
more
the
take,
second, yeah.
take care of
Sorry.
emotional exhaustion. Emotional
Emotion.
exhaustion should be there.
Okay.
As
Okay. That, understood. Understood. Yes, of course. The second
the
is one self-care habit.
One
Yeah.
self-care habit is having your
That's
own
I'm
time.
asking. I'm asking about you personally. What you are you are doing.
My self-care habit, okay,
It's,
don't consider others. I like consider in the sense I don't care whether someone joins me to enjoy. I enjoy it even if it is alone. தனிமையில்
mm,
இனிமை காண முடியுமா முடியாதா அதுதான். Even
yeah.
if it's
Yes.
not I am alone, I can enjoy myself. I
Mm,
go is out alone. If no one is accompanying, okay, I have free time, I'm going for movie. I can go to eat, even some coffee dates. I know I don't need a companion always to go out or enjoy myself. If I am okay, I'm capable of walking. I walk and I go. If I'm capable of driving, I drive and I go wherever I want. So we have
yes.
to meet our small needs every week, at least be it a minimal hours or 30 minutes or 1 hour, just give it only for yourself. Do whatever that makes you happy. That's what I do. Every week I go to beach. Every full moon I make sure I go to beach. And every I make sure I go to movies often. If no one
Yeah.
accompanies, I go alone. Nothing is wrong,
Mm,
okay? And every time I feel stressed, I cook, I eat for myself, and I
mm.
sleep. That's all how I care for myself. Rest. And one thing above all is ventilation. யாரா ஒருத்தருக்கு ஃபோன் போட்டு புலம்பி தீத்தாலே போதும். Everything will
That's
be out.
everybody will do the same. I think so.
Everyone will have that one person to lament everything out. It can
Yeah.
be the workplace colleague or someone outside the workplace. Anyone. We have
I don't want to ask who is that person, that particular person, because that is your personal.
like friends, I have my family. And
Yeah.
what they tell is, it's nothing to put. And that's what I want to make one point I actually forgot to tell is that
Mm,
emotional numbness I told now.
yeah.
Sometimes initially the nurses used to fear or they used to think, okay, what someone will tell if I make a mistake, they will scold me. But as days pass, சும்மா தட்டி விட்டுட்டு போ அது அப்படிதான் கத்திட்டு கிடக்கும்.
Yeah. Yeah.
That when they start building that is a negative coping because they don't repent of their mistake. They don't know what mistakes they are doing. Even they have
Yes.
done, they are getting scolding for that or they are getting remanded for that, but they just dust it off and go. I don't like that one. So if I am getting scolding, if I'm noted down for a mistake, I have to correct that. That is a good way. Just dusting it off, as many nurses do it, as years roll on, they are used to those scoldings or they are used to those words, that they don't care anymore for those words.
Yes. Yes. So I need to put up the two questions along with this reflection. The third one is one myth about the mental health.
Common or for nurses?
That might be a common. Why? Because everybody who sees our web series, it's not about like nurses. Many general audience also will be there. Yeah.
Okay, fine. It is common. I mentioned that earlier in my answers. Like, not all mental illness needs psychiatrist treatment. Some can be cured through ventilation. Some can be cured through journaling. Some can be treated through counseling. So that is what I wanted to say about mental health. So don't think, okay, I might be labeled a psychiatric patient. So don't neglect the care you need. Approach.
Yes. The same social stigma, it is still persisting in the case of HIV and AIDS. It is not going out still now.
But some nurses or some doctors, everyone, though we know
Yeah.
it is not stigma, but when
Mm.
it comes to us, they do it.
Yes, yes. That's a ground reality. We will say that we are doctors and we are nurses, but even though when it comes to our friend who got affected with the HIV because of the needle stick injury, as a nurse,
Ah,
I will think, oh my God, he got HIV now. Yes.
And the thing is, we have to like do what you preach or teach what you do,
Yeah.
preach what you
Yes.
do. And சொல்றத செய்யணும்.
Absolutely. And the last thing, as we had discussed more about the nurses, I want to specifically say about nursing students who is in college. One message from you for kind of the specialist in the mental health nursing. What you will say to our nursing students?
Okay, don't take pressure. Accept
That
failures.
never ends. That never ends for the nursing students.
Don't take pressure. Accept failures. Do everything on time. Like if you are going to a ward and if like he's entering a cardiac ward, he has a cardiac care plan. Complete it on the same week. A care plan will just take 2 hours, 1 or 2 hours to complete. Filing all the care plans till the last minute, that will affect your mental health. Then they will tell we have a lot of workload, we have a lot of written assignments. That is complaining. Okay, so don't take pressure. Complete everything on time whenever it is intimated to be completed. And
Mm,
the second thing is, don't compare yourselves with your peers. Like he's performing well, he's having good marks, or he's having good skills. Everything சித்திரமும் கைப்பழக்கம். So everything comes with practice. Initially you might not be skilled, but you might be skilled as years go.
mm.
So that is the message I want to give to every student.
Great, Kathy, to discuss many things about nurses who is handling the stress. The nursing students also is handling depression and stress nowadays. And happy that I am just starting this VC's podcast along with you in the name of VC and Kathy's podcast. And I want you to be on the next Saturday, 7 p.m. also with a different topic. I know you are in a college. As a faculty, you will be having more and more work in the college in the kind of the education works. But even though you gave us 40 minutes and 1 hour to encourage our nurses to handle the stress and the depression, not only for the nurses, for the nursing students also. That's why our today's session reminds us that caring for the nurses in the mental health is not a weakness. It is essential for the quality of care, personal well-being, and the professional growth. Without that, nothing will be happening. That's why we are reading in the first semester itself that health is a state of physical and mental well-being. But now, no ever nurses will think that the statement. Yeah. Thanks,
Okay,
Kathy. Yeah.
you were telling
Yes.
about nurses. I would like to add on for nurses who are willing to do teaching. Some come to teaching profession since they don't have night shifts. It's only general shift. Every Sunday I get leave. I get to be with my children. But
Yeah.
technical side of nursing was the one thing which I had a good job satisfaction than teaching side,
Mm,
because there I see patients getting discharged in a good health and wealth. But here, in case of coming to the stress point, uh, your 6 hours shift gets over. When you go home, you don't have any other work burden. But being in teaching sector, you have assignments to correct, CAT plans to correct, you have question papers to correct, answer papers, question papers to set. You have n number of recordings, everything, and
yes.
documentation. Don't have that. Everything ends in that 6 hours. But being being a teaching profession, many think teaching is very good, so that I can opt out of night shift, but that is not really the situation. It adds on more work and more accountability because we are shaping the future of nursing. So being a
Yes.
nurse,
Yes.
little less stress than being a teacher for nursing students.
Of course, Kathy, I second this statement. Why? Because when I was working in the ICU, I thought ICU work is very, very, very hectic. Okay. When my wife, she's working, when she was working in a ward, she told it is very hectic work in a ward too. But when I shift my profession to the education, when I touch the college, when I taste the college feeling, what happened is I thought that okay, I need to go back to the clinicals itself. This education, it's very hectic. Yeah. My mother will say that please, VC, you go for a 9 to 4 job. Don't go for a clinical that it will take you a shift and your family well-being will be disturbed. But when I touched a college, she herself felt that no, he is not in the right track now. Why? Because he is handling many things in the college. He is thinking about the MRP, CRP, and writing something box, and it is
Exactly.
hectic. Yeah.
I want everyone who are thinking that opting out of clinical side so that you can not be so accountable. You don't have night shift, but teaching is
Yeah.
not like what you think from outside.
I think so. This is also one kind of a stigma that we have as a nurse.
Yes.
Okay, Kathy. Thanks for joining with us in this podcast. And
Thank you.
we'd like to mention that next episode will be on the next Saturday, 7 p.m. This will be continuing along with the Kathy. Why? Because we need to speak more and more because she has the experience in the clinical as well as in the college side, and she is working as assistant professor. When we this is like a this is not like she's as an assistant professor. Within a 2 or 3 months or 3 years, she will become an associate professor too. So I'm happy that I want to travel along with your journey with this podcast. And thanks so much, Kathy, for giving many more points to us. As I'm also not in depth with the mental health, you said many practical things. Why? Because it is not about the theory. The mental health is not about the theory. It is that practical thing. What is the ground reality? How we are going to handle the stress? Very good, and thanks for everything. And I need to thank the audience, whomever has joined, and they put a comment here. And those who want to see this video after the live ends, it will be in our YouTube channel itself. You can go and just watch it on, and you can share it to your friends and family to know more about nurses and their mental health. Thank you, Kathy, and thank you, audience. We will meet with another podcast in the next week, Saturday, 7 p.m. Thank you so
Thank
much, Kathy.
you,
Bye.
Nandacumar, for
Have a
speaking.
great Saturday and great Sunday. And I want to continue the same stigma on Monday too. That you will go to the college and you enjoy that stigma. Okay.
Thank you. Bye.
Thank you, Kathy. Yeah. Bye bye.